That we have an emergency coming in, the first thing that we do once we get that person in our chair is, after we've diagnosed the situation, we are going to go ahead and propose a treatment plan for them to see what is it that they like to do today. Now, one of the important things is make sure that we're getting them out of pain. And when I take a look at this, a periapical of this tooth, it looks like they've got an infection already. So we're gonna go ahead and see how that looks. Once that tooth is removed, you can see how many roots in the front it has. It has 2 roots on the front part of that tooth, and in the back root, the lingual root is right there, where we already knew that that was gonna come out separately from the tooth itself. You know, as we start our day and we look and see how we're going to be busy today, sometimes we get a phone call that needs attention immediately. Sometimes a person's calling because they've got abscess, they've got pain, and then we have to figure out what we have to do for that patient. And that comes from doing an interview. But before that, we go ahead and take them in, make sure that we know what they've got in terms of the emergencies that they're having. So the first thing that we'll do is do a medical history, and then we're going to go ahead and assess the situation. We are actually in the beginning of the process. We have to go ahead and make sure the person's healthy first, and then we're going to go ahead and take some x-rays. Now, the x-rays that we take are periapical, to show how that tooth is going to be. How hard is that tooth going to be treated? Now, when I take a look at this, a periapical of this tooth, it looks like they've got an infection already. So we're going to go ahead and see how that looks in the mouth. There's another type of x-rays that we take, which is a panorex, where it shows the whole arch, upper and lower, and how our teeth put together and how many teeth that they have. But the most important x-ray that we're taking today would be periapical x-ray, showing that tooth and what's wrong with that. We're gonna assess this tooth is treatable today. Now, sometimes they're coming in with pain, and then when we go ahead and see them, they actually have an abscess. So you'll see in this video, we are gonna be taking out a tooth because the person is coming in with pain because they have an infection, and that's how you determine what kind of treatment that they need. Because when somebody comes in, they could actually just have to have antibiotics, but the real treatment would be being able to go ahead and take that tooth out to relieve the person of pain from the infection that they've got. Process that we have an emergency coming in, the first thing that we do once we get that person in our chair is, after we've diagnosed the situation, we are going to go ahead and propose a treatment plan for them to see what is it that they like to do today. Now, one of the important things is make sure that we're getting them out of pain. And if they decide to go ahead and pull the tooth out, just like in this situation, the first thing we do is we're going to have to make sure that when we take that tooth out, it's going to be numb. And the way that we do that is with local anesthetic. So in this video, we are putting local anesthetic in. We're able to get that tooth numb, and then have the process of extraction start by severing the periodontal ligament on this tooth. And once we get that periodontal ligament severed, we are gonna go ahead and see if we can move that tooth. Now, in this tooth particular, you could see that the tooth is actually fractured from the back side of the tooth. We're working on the upper tooth, and we call this tooth number 3. It's the first molar in the upper right. So when we go ahead and try to loosen this tooth up, we're gonna break the ligaments from the tooth that is attached to the bone. And once we've got that moving, we've got to be careful not to fracture any more of the root. So in this video, you could see how we are moving the tooth slowly, seeing if we could go ahead and grab this eventually with a forceps and make sure that we could move this tooth and deliver this tooth in one piece. This upper teeth right here, number 3, has 3 roots. It's going to come out in at least 2 pieces. So we'll first try to take out this tooth by removing the tooth and the 2 roots on the front of it. And then later on, we'll see if we can remove the tooth, the root from the bone, which is already severed from this tooth. So once that tooth is removed, you can see how many roots in the front it has. It has 2 roots on the front part of that tooth, and in the back root, the lingual root is right there, where we already knew that that was going to come out separately from the tooth itself. Now, sometimes there are situations where we have to put stitches on the tooth, but in this situation, we're able to just keep the tissue around the tooth in a nice position where we don't have to put any stitches. But there are situations where you have to remove the gums off of the bone, and then you've got to be able to put that back. And once that is done, there are stitches that we put in. And one of the instructions to the patient is that you want to make sure that they come back, so that in certain cases you have to remove the stitches. There are also times where you could put materials to save the bone from collapsing, and we are doing that usually now as a filler of bone, a bone grafting material that we put in, so that there's a chance that we could go and put a dental implant here at a later date. Make sure you watch our next video up here, and then we'll see you at our next procedure that we do at View Mobile Dental.